This module will focus on giving learners summative feedback. Summative feedback is big picture, trying to answer these three questions. Where is this learner now? Where do they need to go? And how can I give them specific suggestions on how to get there? And our objectives today, we'll talk about how to assess and define that developmental trajectory, as well as provide summative feedback using an ask-tell-ask model. Let's distinguish brief feedback from summative feedback. Brief feedback, also called formative feedback, can be based on a single observation delivered in the moment. It can be reinforcing or constructive and can often be given in public, something like, I noticed that the patient looked uncomfortable during the ear exam. Try holding the otoscope this way. Whereas summative feedback synthesizes and summarizes your experience with that learner during a given time span, like a week together on this rotation or a 3-month block of clinic. And typically, summative feedback is a more sit-down conversation, meeting in private, and ought to be consistent with the evaluation standards for that learner. Let's compare feedback and evaluation. They're not the same, but they're definitely linked. Ideally, we are constantly in this cycle of observe, giving feedback, observe, give feedback, and then at some point sit down and have a summative feedback conversation and complete any assigned written evaluations. One can visualize these steps as part of the cycle of clinical coaching. Intentionally observing performance, assessing how well they're doing, and formulating that into feedback that you then tell them, then keep watching, give more feedback. But to be effective, the learner should really feel that this is done in a positive learning climate where they have a supportive, credible coach that they can trust. Step 1 of the clinical coaching cycle is observing with intent for those key learning objectives for this learner. An emergency medicine rotation, maybe it's developing a differential diagnosis for undifferentiated patients. Other rotations, maybe it's a specific procedure or a particular patient population. Then ask yourself, what are the key performance indicators that tell you whether the student got it? Is it whether they can deliver a concise, organized plan after seeing the patient, or maybe appropriately interpret a neurologic exam? And finally, seeing where they are now, what is their next step on that developmental path for that skill? As an example, let's take the developmental path of learning how to gather and synthesize data to make a diagnosis. The path usually looks like this. They start as medical students, learning a template of all the questions, and just repeat that back. Then they start to understand pertinent positives and negatives and collect data in a hypothesis-driven way. And then finally, they're able to discern subtle features and be laser-focused in collecting and presenting information. Step 2 is to assess. What is this learner doing well? What can I reinforce? And then what skills can continue to grow? Not that they're necessarily wrong or bad, but they're not proficient yet. Maybe this learner can collect all the data and interpret the exam accurately, but is just not able to put that together to get an accurate differential diagnosis. After observing with intent and assessing where that learner's skill development is, it's time to actually give the feedback in step 3. We've all heard about the feedback sandwich, but let's reframe that and make this more of a conversation using a model of ask, tell, ask. Start by asking the learner to self-assess. How do they think their skills are in this domain? This helps establish this as a conversation. Then tell them your assessment, validating and reinforcing things that they're doing well, and telling them specific places and ways to improve. And ask, what are some ideas you have for improving on this skill? And then offer more expert suggestions.
Well, thank you so much for meeting with me today, Sarah. As today is my last road day on the rotation, I just want to sort of meet with you.
Let's watch a brief 2-minute video that shows a summative feedback conversation between an attending and an acting intern on an inpatient rotation. And listen explicitly for the ask, tell, ask
that will
by the
provide you a
attending.
lot of opportunities to work on some of those efficiency things that we've been talking about. And I think that, having an efficient approach to how you gather data can help you make more informed decisions. And I think that's super important regardless of the rotation. So how have you think, your efficiency has been going up to this point?
Well, I would say early in the month, I was having to take multiple trips to the emergency department because I realized I forgot important information to ask the patient, so I'd have to make multiple trips there, or I'd have to ask a resident if I didn't have the test result that I needed. So it's better, but I still feel like I'm pretty disorganized, or sometimes I don't have the information that I need.
Got it. And I would agree. That's certainly something that you should keep working on and improving on. And I noticed even a few times this week, we would go see a patient and you wouldn't necessarily have things like important lab results or ins and outs or maybe an x-ray result that was really important for the medical decision that we were working on at the time. And so I think I just want to sort of delve into, what strategies are you using at this point to sort of work on that process?
Well, I use a sheet of paper and I just try to break out those big categories like surgical history, medications, or imaging, just to make sure I don't forget those.
Absolutely, and I think that's very helpful. Another thing that I might recommend is maybe you spend a couple of minutes before you go see the patient and, sort of pre-plan your data gathering. And that can be based on the differential or the active problem, and then use that sort of pre-planning time that you spend maybe to create checkboxes about things that you don't want to forget. So like in pancreatitis, did you ask about alcohol use? Did you ask about medications? Did you, talk about gallstone history? Or if you have someone who has an AKI, have you already gathered the creatinine and the urine output? And just spending those couple of minutes pre-planning might help, and you can certainly do that in clinic as well.
Yeah, that's a great idea. I'll give that a try. Thank you.
Of course.
One barrier to giving constructive feedback is really trying to find a way that will make it easy for learners to absorb rather than be defensive. So let's talk about a couple ways to do that. Using a learner who tends to want to order way too many tests. One is to use the future focus. Instead of emphasizing that the way that they did it was wrong, share how to do it even better next time. State the observation. I've noticed you tend to order many diagnostic tests all at once. In the future, trust your pretest probability and limit testing to those most likely or can't miss diagnoses. Another strategy is to swap it. State what practice needs to change and give them an alternative way, such as, instead of ordering tests to rule out everything, trust your clinical judgment and start with the top 2 on your differential diagnosis. Another strategy is to share the struggle. Acknowledge that this is something that you had to learn too, and share what you did to master the skill. Perhaps by saying, I've struggled with over-ordering tests too because I didn't want to miss something. But I want you to trust your history and exam and just order those couple tests to rule in or out your most likely diagnoses. So let's summarize and revisit our clinical coaching cycle. We're going to observe with intent, assess where this learner is on their developmental path, reinforce what they're doing well, and give them specific suggestions on how to do it better next time. And then finally, at the conclusion of a rotation or your time working together, sit down and have a summative feedback conversation using the ask, tell, ask model. Medical education is a journey, and by the end of this conversation, we want our learners to know this is where you are now, this is where you need to go, and here are some turn-by-turn directions to help you get there.